warmest regards to all my friends and colleagues on this occasion of your wonderful conference on Will, Emotions and Reason, Health and Pathology in the Contemporary World. It's Thanksgiving here in America, here in New York, where I am, and it's a perfect time to give thanks for all the friendship and all the work that we have shared over all this time. I'm very honored to have participated in many of your past conferences, to which these books attest, since I have chapters in many of them, and look forward to my chapter in this conference. I recall very fondly many past conferences and workshops like this one. I'd also like to give thanks for a very important initiative that just took place in Moscow right before World Mental Health Day. This conference brought together colleagues from all fields related to psychotherapy from around the world in order to unite these disciplines together. This was very important for the future of our entire field and major for the conference that you're having today and all the work that you're presenting and doing. I was very honored to be part of this conference. Importantly, the newly formed Union of Mental Health brought together the PPL as well as World Council of Psychotherapy and many other organizations. What was very important, and for which we also need to be thankful, is that this conference was under the patronage of ministries of the Russian Federation, showing the important support that the government has for psychotherapy. This included the Ministry of Health of the Russian Federation, the Ministry of Education and Science, the Ministry of Labor and Social Protection, and the Ministry of Sports.
Конгресс проводится по инициативе российских некоммерческих общественных организаций, которые объединяют психиатров, психотерапевтов, психологов, педагогов, юристов, социальных работников, деятелей культуры и спорта при поддержке органов государственной власти Российской Федерации.
Впервые на таком уровне смогут обменяться мнениями и психиатры, и психологи. Для нас это представляется чрезвычайно важным.
Importantly, a deputy prime minister of the Russian Federation attended and emphasized the importance of mental health for youth.
Мне хочется пожелать всем участникам конференции успешной работы, очень серьезного взаимодействия во имя психического здоровья общества.
Вопрос психического здоровья на сегодняшний день становится приоритетными во всем мире. По прогнозам ВОЗ к 2020 году психические заболевания выйдут на первое место в структуре заболеваемости и опередят даже сердечно-сосудистую патологию. Поэтому это вопросы актуальные на сегодняшний день для всего мирового сообщества.
I really enjoyed listening to a number of experiences from Russia and was very fascinating to see that a number of disciplines and professions are contributing to the mental health progress in the country.
В рамках Конгресса эксперты в области психического здоровья обсудили этические аспекты отношений с пациентом. В круглом столе приняли участие генеральный секретарь Всемирной психиатрической ассоциации Рой Абрахам Каливаялил, секретарь-координатор секции Всемирной психиатрической ассоциации Афзал Джавед, представитель Международной ассоциации прикладной психологии и Всемирного совета по психотерапии в ООН Джуди Kuriansky, согенеральный секретарь Всемирного совета по психотерапии Дарлен Немет и вице-президент Союза охраны психического здоровья Владимир Бородин. Психическое здоровье в повестке Дня устойчивого развития ООН до 2030 года.
I was very honored to be asked to deliver the final outcome statement of this meeting.
По итогам 2 дней работы был собран и выпущен сборник научных статей, а также принята международная декларация, где перечислен целый ряд действий, направленных на сохранение психического здоровья человека 21 века.
We emphasize the continuing severity of problems associated with the stigma of persons with mental disorders, professionals working with them, and mental health in general. In this regard, we welcome any valid effort, including on the part of the media, aimed at destigmatization of these persons and professions. We believe that our priority tasks should be as follows. 2. Promote the widest possible dialogue on mental health protection between all stakeholders, organizations, and communities, both professional and non-professional. We've been doing that here. Promote awareness and understanding of the importance of mental health and well-being in all sectors of the population and the society. Yes. Develop and implement a comprehensive treatment and rehabilitation and prevention-based programs aimed at the recovery of the mental health of individuals throughout the entire life cycle and the population as a whole. We should say DA to that. All ages. DA. Ensure a structure of efficient, effective, and evidence-based mental health systems integrated into primary health care that rely on the resources of state and public organizations, professional, and other communities. We've been talking about that. We need a DA for that. DA.
Now, on this day, as I give thanks to all of you, I'd like to make 2 points about the topic of this meeting. One is about emotions and reason. I'm a great fan of what's called brain style preferences, and I've presented some of this at the seminars that I've been very honored to be there with you and to give to the PPL. In terms of brain style preference, we have a style for either being emotional or being rational. It's important to help patients to understand that that is their style, and that neither style is right or wrong. Also, we can learn, if we're more emotional, to use the rational part of our brain. And if we tend to be more logical, to learn to bring up more emotions. Why this is important in psychotherapy is that many times couples have one preference for one partner and the other partner has another preference, and this creates conflict. Helping them to understand that they have a different style, to understand what each style is like, and then to be able to compromise and adjust. Also, we can learn to bring both styles together. Another important point related to the topic of the conference is about will. I am a great fan of the concept of locus of control, based on early research by Roeder in the 1950s. Locus of control means, do we believe that we are in control of everything that happens? Or is it destiny or fate? Certainly when it comes to disasters, which work I've done all over the world, there is clearly nothing you can do to control those events. But when it comes to your own behavior, there is a certain amount that you can control and determine what you do. Certainly, we can control our own reactions to what others do. So I've developed what I call the rule of thirds. You can control your own actions. You can't control what others do, but you can control your reaction to that. And there are certain events that happen in the world by nature of which you don't have any control. So that is a way to take a look at the concept of will. I love the issues that you're about to discuss at this conference. I send my warmest regards to you, and I very much look forward to working with you for a long time in the future. Of that, I am very thankful on this Thanksgiving Day in America.